Hello everyone, in this video we will look at the ocular condition keratoconus. Keratoconus literally means cone-shaped cornea. Now keratoconus means that it is a progressive, non-inflammatory, bilateral ectatic condition of the cornea. So it is progressive, which means it progresses with time. It is non-inflammatory, which means it is not accompanied by any inflammatory conditions. Bilateral, which means it happens in both eyes, and ectatic means that it leads to a bulge or an ectasia in the cornea, and it eventually leads to a cone-shaped cornea. This condition starts at puberty and eventually progresses in life. The pathogenesis is that it is believed to be caused due to any developmental anomalies, or it could be due to a degenerative process, or due to some endocrine anomaly, or some sort of a corneal dystrophy. So it could be a developmental thing, or a degenerative, or endocrine, or due to dystrophy. And because of all of these processes, there is defective mucopolysaccharide and collagen formation. So the mucopolysaccharides and collagens present in the cornea are defective, which lead to thinning of the cornea and eventually ectasia. As you can see in this image, the cornea is bulged out. It is ectatic because it becomes thin due to defective mucopolysaccharides. And since the cornea becomes ectatic and bulges out, the corneal curvature increases. Any increase in the corneal curvature leads to myopia, and since the cornea is ectatic and bulged out, it also leads to astigmatism. In the clinical features, the patient will complain of visual disturbance that will be in the form of blurring of vision, and the patient can also complain of glare and halos. Halos will be seen when the patient looks directly into light, and there will be a complaint of glare also. Also, the patient will complain of irritation when looking in the light, and there might be also be photophobia. In the signs, we will see that in the cornea there is a bulge which comes from the central part of the cornea. And since this is a cone-shaped anomaly, the apex of the cone will lie below the center of the cornea. If we do a Placido disc test, we will see irregular circles. On a slit lamp examination, we will see thin and ectatic central cornea. As I mentioned, the bulge comes from the central part of the cornea, so the central cornea will be thin and ectatic. There is a particular ring called as Fleischer's ring, which is seen in keratoconus, and this is a ring where iron is deposited. This can be distinguished from Kaiser-Fleischer ring, which is seen in Wilson's disease, in which copper is deposited. In Fleischer's ring, we will see iron deposition. In Kaiser-Fleischer ring, we will see copper deposition. Then we have Voigt's striae, which are vertical lines seen in the stromal part of the cornea. Some specific signs are on retinoscopy, we will see a scissoring reflex. On distant direct ophthalmoscopy, we will see an oil droplet reflex. Then we have Munson's sign. In Munson's sign, what happens is when the patient is asked to look down, the lower eyelid will bulge due to the ectatic cornea. So we know that the cone type anomaly is bulging out, and when the patient looks down, this bulge causes the lower eyelid to bulge out. This is called Munson's sign. In Rizzoti's sign, when we throw light from one side of the eye, it leads to formation of an arrow shape on the opposite side. The overall investigation of choice is topography. Keratoconus can be classified on the basis of size. It can be called a nipple cone deformity if the size is less than 5 millimeters, an oval cone deformity if it is 5 to 6 millimeters, and a globus cone deformity if the size is more than 6 millimeters. There are some conditions that keratoconus can be associated with, and those are ectopia lentis, vernal keratoconjunctivitis, cataract, aniridia, atopic conjunctivitis, Marfan's disease, asthma, eczema, hay fever, Down syndrome, Ehlers-Danlos syndrome, osteogenesis imperfecta, and mitral valve prolapse. So if you observe here, the different kinds of conditions that we are getting are either connective tissue disorders which lead to defective collagen formation, or we could have allergic, hay fever, eczema, asthma, atopic like conditions in which the patient tends to rub the cornea too much or rub the eye too much, and that can also lead to degeneration of the cornea and ectasia. For the treatment, we can prescribe spectacles in the early stages and also contact lenses, which are specifically rigid contact lenses. But later we have to go for a surgery, in which the surgery we can use is intacs, which is insertion of intracorneal ring segments inside the cornea, which lead to flattening of the cornea. Other than that, we can use corneal collagen cross-linking with riboflavin. Corneal collagen cross-linking with riboflavin. Keratoplasty is a late procedure.